Welcome to Inside Style. I am your host, George Worrell, and thank you for tuning in today. Topic dear to my heart is wellness, mental health, and style. So today's topic is styled from the inside out. My guest today is clinical psychologist Dr. Lauren Fisher. Dr. Lauren Fisher is a licensed clinical psychologist, entrepreneur, and owner of the Del Rey Psych Wellness in Alexandria, Virginia. Beyond her clinical work, Dr. Fisher serves as the president of the Del Rey Business Association and is passionate about building community through small business collaboration, wellness, programming, and neighborhood events. Her mission is to help people move from feeling stuck to experiencing meaningful healing, connection, growth, both individually and collectively. Welcome, my friend.
Hey, thank you for having me. I'm glad to be here.
Yeah, and I love the red dress.
Thank you.
Or orange. Orange, red?
Red, sure.
Yeah.
You tell me.
Yeah.
You're the expert.
I love it. And I love what we met in Del Rey through a mutual friend and business owner. And I'm always interested in wellness. And so is this a career? So we have something in common, New Jersey, New York.
That's
you grew
right.
up where in Long Island?
Yep, right, Jones Beach, about 40 minutes outside the city.
I know Jones.
Yeah.
I've never met anybody that lived near Jones.
Get out. That's me.
Wow. How was it growing up there?
I loved it, real classic suburban, but the beach, you're a beach person, you grew up, right?
Yeah.
So, it was a great upbringing. I always felt like I wanted to leave, go somewhere else, and I did, but I really appreciate now the connections and the community that were there, and I think that served a great foundation
for you. Yeah. Where'd you go to college?
I went to Mary Washington College, which now is the University of Mary Washington in Fredericksburg. My father was obsessed with history, and we would go up and down the coast. And he loved Virginia, so we came down here, and I've never left.
So did you know that this is something that you wanted to do? Was this your course, your journey, your passion about talking about mental health and being a psychologist?
Yeah, no, so everyone always asks, and yes, I knew from an early age that I knew I wanted to help people, and I loved stories. So I remember in high school, people would always come and tell me, and I loved problem solving and just listening to them. And then Silence of the Lambs came out, and I remember that movie, and I was like, wow, how fascinating. I'm still fascinated with serial killers and sociopaths, even though it's not who I work with. But it got me just really thinking about the intricacies of the human behavior and mind. I will say, that's what I always say. I studied mental health, went straight on to grad school. But in my later healing work, what I realized impacted me a lot was my mother's mental health journey, that she had a significant major depressive episode in her 50s. Seeing her go through that, as well as come out of it, and see also her and my father go through couples counseling and repairing their relationship. So, that's not always what comes to the forefront, but I now realize later how much that also shaped.
And she was open for help for the depression? And it came naturally because many people in certain communities, I think mental health is something that people champion. I know growing up, people didn't talk about it. I have an aunt who's paranoid schizophrenic, and it was things that something's wrong with her. Oh, she's just. Yeah. Kind of brush it off. Nobody talked about it, or they would help, or they would try to help, right? But they never thought about professional help. And knowing now that we're not equipped. The average person is not equipped.
No.
Yeah.
Now we're doing right. It was you're just issues of generational trauma, but that wasn't the way, right? In the Great Depression and other areas, right? It was about survival, right? You don't have time to process emotions, but they also didn't have those resources. So it's great to see every generation getting better. And now that I think about it, even my mom going to therapy then, and this is 90s, still, I don't think it was as popular, open, or spoken about.
But it helped her.
Yeah, she was a trendsetter.
Yeah. I love it. What was your first job?
In general? Oh, my first job was slinging
Hash?
hamburgers. No, at the Jones Beach boardwalk. Actually, that's not true. I owned a babysitting business when I was 12. I got inspired to be, I never thought I was an entrepreneur, but I started my own babysitting business when I was 12, and I had 2 or 3. But then my first real paid job, per se, illegally employed, was working at the food service. And I worked at restaurants and food service. I think that's really important. But my first psych job, I'm going to tell you because it's amazing I ever went in the field.
Okay.
It was a psychiatric hospital in New York for children, and I had no idea that I was going to get beat up every day and bit. Like, they had these like arm guards and stuff like that. But what I now know about children and trauma and things of that nature, like, I understand the extreme behaviors. At that point, I was just trying to do what I could to help.
But what was the results? Did you see any results from what you were doing and what the hospital was trying to do with the kids?
Yeah, no, I don't think it was a really greatly run. I think their job was to stabilize children. A lot of children were coming from the inner city and were, suicidal and depressive. So, I think they did their job of stabilizing how much help they were truly doing. Because also that goes to a bigger thing in the field about, like, how much attention's been paid to trauma work, Okay.
What's the difference? What's the difference in trauma work and just saying, like me, when we were talking earlier, that issues, it wasn't trauma, it wasn't anything from my parents, it was how I felt about me, right? And took me down that road of alcoholism, 30 years clean in August 17th, right? Beautiful childhood, grew up in the beach, Atlantic City, friends, no financial problems. My parents have been married 67 years. And not knowing that I did not love myself and that I was looking for something that was within me. Like, I looked through it through people, I looked through it through alcohol. So is that trauma?
That's a great question, because in childhood we develop positive and negative views about ourselves, the world, and others, right? And that's shaped by our experiences. So I think that there's big trauma, which is more well known, right? Our big single incidents that affect our sense of safety, right? War, sexual assault. But then there's also, right, what we call little T's, is series of chronic experiences that contribute to the way that we see ourselves. So one might say systemic racism, right? You could have a parent that just didn't meet your needs. They were absent, maybe they weren't necessarily abusive, but any kind of system of behavior that happens over time that impacts you. It could be bullying. So sometimes it's like small chronic, but small repeated experiences that impact the way that you feel, or it's safety, or the way that you see yourself. So for what you do now, fast forwarding, let's talk about your wellness center, because that's a wonderful word about wellness. That's something we should all be looking for. So tell us about the different things that you offer, but let's talk about different segments of mental health that you see. It would be okay for me to tell you a little bit about my journey. Even though I knew I wanted to be a psychologist, I've evolved over my career, and I think it's important to share, because I started off with diagnosing and assessing. I was really interested in helping people figure out what is the nature of their mental health problems. Some people don't know, do I have ADHD, do I have bipolar, do I have this? And that can be really helpful. But it was diagnosis heavy, in which historically our field has been pathology oriented, right? So after that, I got more into therapy, and I had my own awakening, if you will, and started to like mindfulness and meditation and reflecting, not just talk therapy. There's a lot of approaches, but there's a very cognitive behavioral therapeutic approach. But as I got into looking into the body, I realized that talk therapy was only taking people to a certain level. It could be very helpful for a variety of issues, but a lot of times and why I evolved, I'll say, into a mind-body therapist, which is where we are. We're a holistic psychotherapist. And we realize that you have to work with the entire system. And the main reason is because a lot of us have experiences of some level with trauma of some sort that have affected our nervous systems, whether that creates us to feel stuck, disconnected from our emotions, or potentially living in a fight or flight state. So that's been a big piece of working with people's nervous systems, whether we label it trauma or not, but the whole mind-body approach, because every part affects the other.
Okay.
The mind, the body, the spirit.
So if I'm feeling stressed and I don't drink and I don't smoke, I'm going to buy some honey buns.
Right.
That's me.
Yeah.
I'm out of honey buns. And my friend Steven, he's just like, how many honey buns you? I was like, well, they're really small and there's only 6.
My spirit hears you. Emotional eating has definitely been.
But that's my.
So where we are today. So our main practice, Delray Psych and Wellness, we're a group of holistic psychotherapists specializing trauma, addiction, couples counseling. So we see individuals and couples, no children right now, and I'd say that we have the trauma emphasis as well. So that does separate us out from some other people with the modalities that we use, EMDR. IFS, and now we're also recently added psychedelic assisted psychotherapy. We use ketamine assisted psychotherapy, and that's pretty cutting edge for the East Coast.
Yeah, what's ketamine?
Ketamine is, and it's legal. Okay, so ketamine is an anesthetic. So if you've ever had surgery, it's a sedative.
Okay.
Also on the streets known as Special K, the horse tranquilizer. Some people are like, but when used intentionally in the right way,
so you have to be trained and certified and okay.
We work don't try it home.
Okay.
It's actually really fascinating. I don't know how much you're in the loop with psychedelics and mental health care in general.
I just know about psychedelics.
Yeah.
But,
a lot of people have had personal experience, the research is really robust with ecstasy, MDMA, psilocybin, mushrooms. Like every major hospital is doing research now, and ketamine as well. And ketamine specifically is treatment-resistant depression, severe OCD, and alcoholism. It's very helpful with, and PTSD. So
what does it do? I'm sorry. I'd like for our listeners, so using that, what is the ultimate goal for?
It's a short-term intervention, unlike these other SSRIs and other medications you take ongoing. And the stats are coming out roughly that those medicines are only helping 50% of the people, or only helping you to a level. They have a lot of value, but people are just tired. They're like, I'm still depressed. I'm going to therapy. I'm doing medicine. Like, what else is happening? So what's cool about the ketamine is it works on a different part of your brain. It works on the glutamate system. So, what it's helpful for and unique to is that it helps to repair neural pathways in your brain that have been damaged by chronic stress and depression. And it helps to grow new pathways. So anytime we're setting a new behavior or mindset, we're setting, the habit takes 21 days, but guess what? We have trouble changing because we resort back to what we know. This makes it a lot easier, so it's super cool. But it also has antidepressant effects, anti-anxiety effects. And when used in a medical model, it has symptom reduction. When used in a psychotherapeutic model, we're there while you're on the medicine, and we're helping guide you through the journey.
Okay.
So it shuts down your thinking brain, all those voices in your head, the committee. And it helps you tap into your inner healer and your inner resources. So what comes up for healing will come up, because we actually think most people do have all the answers inside. We've just been, that's a whole
I've never heard that.
Oh, yeah.
I've never heard that we have the answers, and your job is
to guide you back there. We're born whole, the world takes us away from our wholeness, right, by our experiences or things of that nature. So, this is where that whole broken concept comes up, and I'm just like, you're not broken, you're just separated from yourself. So when we really truly believe like we're already whole, we're just finding our way back or shedding the stuff that we've learned, like you said, maybe the negative thoughts about ourselves, or reworking our nervous system because we've been on grew up in an environment where you were like had to like be on alert 24/7 because it wasn't safe, you know.
When should we think? At what point does anyone think that you suggest that you should talk to somebody?
I feel like everyone should be talking to someone.
Yeah.
Because, well, it's just about, I think, anyone who wants to live more in alignment with their self, like their values, their relationships, their purpose, like, you know, anyone should be taking a look at like how do I function in the best way for me, you know?
But you have to think that way first.
Well, right. That's what we're here for.
Yeah. So you know what I mean? Like, there's generations, there are people that I know that we may think need to talk to somebody, but if they don't think they need to talk to somebody, it's you. Yeah. One of the things that I learned in AA was that it wasn't about the alcohol and it wasn't about the other people. Everything started and ended with me. Yeah. So every day for 30 years, and whenever I went to meetings and when I was reading, when I was talking, I had to look at me. There are many times had I not, before I got into that, to AA, it was you. Mm-hmm. My mother, you know, if she hadn't, I wouldn't, you know, if they would have accepted me because I was gay, you know, or if I was black. So that's, you know, somebody listening. Right. One of the things maybe why we should talk to someone that's professional. Yeah. And it kind of just brings clarity, you think?
Sure. Yeah. Well, I think you're hitting on something else that's really important. So, I mean, just to address your question, like a lot of people end up in therapy because something has happened, right? There's been a big shift. You don't have to wait till you're depressed or anxious. Like a lot of times we're just a little subclinical. Something's off. We're not in alignment, right? Or maybe we just want to feel better about ourselves. You know we have a constant critic. So it's always better to be doing that than waiting until like you're, you know, it doesn't matter. But at any point, you can come in crisis or you can come ahead of time, or if you just want to be ahead of the game. But, you know, what you talked about also, or what's coming to my mind, is that there's different ways therapy can be utilized, right? One is, of course, practical strategies, right, and guidance to help you figure out how to reach your goals. But there's also a lot that happens in the relationship. So there's a lot of healing in relationships. And so sometimes just being seen and understood and not judged, you know, if you're a good therapist. I do hear some horror stories, but like to just be there and to be vulnerable and to be seen, there's so much healing that can happen just in that therapeutic relationship that has nothing to do with strategies other than just rebuilding trust that someone thinks I'm important here, I'm worthy, right? And they want to help me, and we give this unconditional care and love.
There's a show on Showtime. I can't think of the name of it, but it's set in New York, and the therapist, you see live real couples come in and talk about, and it was so fascinating. Have you heard about it?
I think couples therapy.
Yeah, maybe. Couples therapy, that's what it's called.
Yeah.
But she goes in front of a board as well, and they talk about cases. Is that normal for therapists to be able to talk about, to get some more insight about what they're doing from other people in the profession? Yeah,
in fact, it's probably the number one thing you should be doing. We're fortunate. We have a group of 8 or 9 therapists at our office, and so doing case consultation is a weekly thing. And everyone has a different area of expertise and perspective, so we are often sharing without identifying information to say, you know, how do we best serve someone, because I'm 20 years in. I'm a way better therapist than I was at year 5, and I'm going to be way better in 20 years from now. You're constantly
changing,
learning and evolving. And I do think, like, out of all the things, and I'm not going to say I'm never going to be the world-renowned psychologist, but I'm great at relationships and making you feel like you matter. And that research shows about the therapeutic relationship, you know, is super important. It's really important.
So 2 things. One, you just hit on about making one feel important, and I'll probably say this until I die. During the pandemic, I got a false positive for COVID. Like mental, like I started experiencing anxiety, things I've never, ever experienced in my life. And between Dr. Swartz, who was my primary physician, and Deborah, my psychiatrist, I know they had thousands of patients, hundreds or whatever, right? But each time I talked to them, I felt like I was the only patient that they had. And Dr. Swartz was able, because I was like, I was taking those COVID tests. Like once they had me on speed dial. I'd be like, I'm on my way, and I'd get the results before I got back. And one time I was going to go to Sibley, and I was living in a fabulous loft, but it was dark. Yeah. And I could feel the depression coming. Like I could feel it coming, and I couldn't do anything about it. And I would have to go outside sometimes. And I remember I said to Dr. Swartz, I'm going to Sibley. And she said to me, she's like, George, they're not going to be able to do anything. And it was her way of... And everything stopped, and I started thinking, like, you're overreacting. Calm down. Yeah. Like, and she didn't say it. It was just a slight difference in her tone that I was able to connect with.
That's really important. Like, we have to do as therapists a lot of work ourselves. But, like, you know, we were talking a little bit before about how to de-escalate people and things. And so... You imagine you had an anxious therapist and you're anxious and they're like, I don't know where you should go. Maybe you should go there for the COVID test or that. You'd be like, you know? Yeah. So, but for what I'm hearing you say, and something we work on really hard, is that just to say it in a certain way that your nervous system heard that and you're like, okay. I'm okay.
I'm back to reality, because I was like panicked.
Yeah. You got
like, and she's just in the best way possible. Can we talk about transition? I want to talk about the mental resilience. Resilience. I'm sorry.
Yep. We got a lot.
My overbite. Yeah. In times of transition, and you know, there are a lot of changes, career changes for people. Yeah. For me, it's always been reinvention, so I'm used to it. But what about the person who has been working a job for like 30 years, 40 years? They're going to retire, and all of a sudden they don't have it. What are your suggestions? Your coping? What do you think?
Yeah. Well, I think everything's about like a framework, right? So how do you view retirement, right? Or how do you even view a crises, right? So when transitions, like, we'll just use a retired person, like, when they're like, I don't know what I'm going to do, this is all I know, right? They're not looking at, like, spanning out to be like, okay, well, it's a new chapter in your life. What else are you aligned with? What else might you do that is going to fulfill a different part of who you are, right? To bring that purpose and peace. So I think there's a lot of like narrow thinking that needs to be broadened out, that just people don't have experience with it, right? You talk about that, and I think I just want to like say something you said about like you felt anxiety and depression for the first time, or you know, with the COVID, or things you had never experienced, and that does happen to us at different points in life. Normally when I think there's a transition or there's something that comes up, and you don't have to have all of it. I think you just need to be open, right, to either help or to thinking about things in a different way. And often when you just expand people's perspective, then they feel like more in control to make choices. I think when we don't feel like we have any power is when we start to get like stuck and scared. And we always have power. Even in the worst situations, you still have that choice in how you react to something, right? Or how you move around it. So I think some of the most resilient people are people that can pivot, right? Okay, like acknowledge how bad it is and what's happening, but like what now? You know? Or what do I take from this and how do I grow? What do I learn?
So you know my background in fashion, and one of the reasons I started this podcast is style, because style to me is more than fashion. It's your lifestyle. And so I always think about inner, outer, and then your clothes. Do you think that your professional opinion or just what you think personally about. Yes, we're working on the on the inside and doing all these things. Do you see importance of the outside, of being well groomed and knowing and getting dressed according to your lifestyle? Could we talk about that for a bit?
Yes. Yeah. I mean, I think it's somewhere between 60 and 90 seconds where that first impression, people are taking in a lot of information and they want to know, like, do you feel safe and trustworthy? And are you, like, respectable? Like, can they respect you? And so I'll speak to just something we've had within our practice. I had a wise mentor back in the day who was my very first psychologist job. And I think it was even my off day. I wasn't seeing clients, but I was wearing like flip-flops. And she's like, no. She's like, you don't do that. Because she's like, there's still clients walking through. And she's like, people are making judgments. She's like, and I was 26 when I first became a psychologist. She's like, you're young. They're going to judge you. And she's like, you always want to present a certain way. And so I've carried that over. And as a Zennial, I'm a little more Gen Xer, there's some different generational values. And with and it is changing some of the younger generations of therapists want to wear sneakers and more different fashion. At the end of the day, I'm like, all right, as long as you look put together. But, especially as a professional in which people are coming, this is my opinion, some people are going to differ on this, but I truly think, like, they're spending money, they want to trust you. This is like that branding you said about from the beginning, like, whether it's your intake process to what they see on your website to who do these people look like they know what they're talking about? Yeah. I mean, we might be well dressed and we don't, but I think it's important.
Yeah, I always tell my clients to dress for the office. I mean, for the office that you hold.
Yeah.
Not you.
Yep.
Now, you can put a little bit of you in it, but it should be like if you are a council member, a mayor, a congressperson, you've picked fields, therapists, whatever, that I'm coming to see you professionally, or you are a professional.
Yeah.
There's rather if the person doesn't see it. I always say that your eye is trained to see what's wrong. My eye is trained to see what's wrong first before I see what's Snickers. Yeah.
It's like legit neuroscience. Your brain is scanning for negative all the time. So.
Is that?
Yeah, it's that old survival mechanism where we'd scan for, and it's still part of us. That's why we are often looking backwards and forward, and not being present, because we're like.
Does it also breed a bit of negativity?
Sure.
Because I see people that, like, I'll show them something, a video, and it'll be like, oh, well, you should have used that music, or that you find what's wrong overall than seeing what's right about it.
Yeah, people can be skewed that way unless you're doing a certain. Like mindfulness and other things help to be more holistic so you can take it in both. But I mean, we could go down a rabbit hole with some people being very negative.
Yeah.
But
you're going to have to come back and talk to us. Okay. I can talk about this all day. How would our listeners get in touch with you, or with social media, or thinking about an appointment, or want to know more?
Yeah, absolutely. So our website is delraypsych.com. And we are on Instagram and LinkedIn. So that is a way to find out more. And also, I just want to say that we're in Delray, and we're situated, we also own the wellness center that we're situated in. It's called the Wellness Junction. If you've ever been in Delray, it's a big blue building. We've got dog treats out. We've designed the whole building to be very welcoming, but we also have other health professionals in there with us: massage, organic facial, naturopathic physician. So we really wanted the opportunity to co-work with other similar disciplines, because we do really, that mind-body thing is really important. So.
Well, I may come and bring my cameras for neighborhood favorites.
Well, we'd love to have you anytime.
Yeah.
Yeah.
That's going to be really cool. Well, thank you for taking the time, Dr. Lauren Fisher, and please reach out to her. And for anybody that's suffering out there, please get help. There are 800 numbers. You can Google them about getting help, mental health. Don't do anything on your own. Reach out to someone. We want to thank you for tuning in to Inside Style. I am George Worrell, and remember, real style starts with being comfortable in your own skin. We'll see you next time.